Cardiologist warns never take B12 with these two common medications after 60. To all seniors out there, if you routinely take a vitamin B12 supplement every single morning, it is absolutely crucial that you pause for a moment and carefully watch this important message before reaching for your next dose. At this very instant, as you are watching this video, a subtle yet significant process is unfolding silently within the bodies of millions of seniors throughout America. This insidious process is particularly concerning because it presents with no obvious symptoms. There's no pain, no unsettling dizziness, no alarming chest tightness, or any other immediate sign that would compel you to put down your morning coffee and immediately dial your doctor. Despite its silent nature, this phenomenon is insidiously and quietly elevating the danger of serious cardiovascular events like stroke and heart damage in individuals who genuinely believe they are diligently doing everything right for their health and well-being. Paradoxically, one of the most widely trusted and readily available supplements found on pharmacy shelves, vitamin B12, can unfortunately become a source of significant danger when it interacts improperly with certain common medications. And this is a critical piece of information that your doctor, due to time constraints or oversight, may very well have never explicitly communicated to you. Specifically, when high doses of vitamin B12 are combined with just one of two particular frequently prescribed medications, it triggers the formation of an undesirable molecule known as homocysteine. This molecule, homocysteine, behaves in a profoundly damaging way within your body. It essentially acts like coarse sandpaper, gradually abrading the delicate inner linings of your arteries. This persistent internal friction and damage dramatically escalates your risk of experiencing a stroke, potentially increasing it by multiple factors. Today, I am going to clearly reveal exactly which two common medications become dangerous when combined with B12, especially after the age of 60, and precisely how you can effectively protect yourself from these hidden risks. Before we delve deeper into this vital information, please take a moment to drop a comment below and let me know where you are watching this video from. Your geographical location helps us understand our audience better. Also, please hit that subscribe button right now and make sure to turn on all notifications because I consistently share life-saving health information, much like what you're about to hear every single week. Now, please type your current age into the comments section, just your age, nothing else, because the critical information I am about to share hits differently and has varying implications depending on how long you have been taking these specific medications. Here's a crucial piece of information worth knowing and understanding before we proceed to a more in-depth discussion. A significant study that was published in the highly respected Journal of the American Medical Association made a surprising finding. It revealed that seniors who regularly took high-dose B vitamins, which prominently included B12, over an extended period, actually demonstrated an increased cardiovascular risk under certain specific conditions when compared to those who were on lower doses. Notice, it was not a decreased risk, but rather an increased risk. This particular finding initially stunned and puzzled a great many professionals within the medical field. However, once you fully grasp the underlying physiological mechanism at play, it makes complete and undeniable sense. Allow me to illustrate this complex process by telling you about Dorothy. Dorothy was a vibrant 71-year-old woman, as sharp as a tack and a proud, retired school teacher. She maintained an active lifestyle, diligently walking every morning, and made sure to take a handful of various supplements every single day with her breakfast. She did this because she had read extensively that after reaching the age of 60, the body's ability to absorb essential nutrients naturally diminishes. Vitamin B12 was prominently at the top of her supplement list. Dorothy was genuinely proud of being proactive and taking charge of her health. What Dorothy, however, tragically didn't know was that she had been prescribed metformin for her type 2 diabetes and had been taking it consistently for nearly 8 years. And for all those 8 years, no medical professional had ever taken the time to sit down with her and thoroughly explain what metformin does to B12 absorption over such an extended period, or what potentially harmful consequences could arise when her body tried to compensate for this imbalance. Her daughter began to notice that Dorothy had been experiencing more profound tiredness than usual over the past several months. It wasn't just a sleepy kind of tired, but a deep, pervasive drain that even a full night's sleep couldn't fix. Dorothy, attributing it to the natural process of aging, dismissed it as a normal part of getting older. When her blood work was eventually pulled, and importantly, her homocysteine level was included in the panel. The results revealed a pattern that had unfortunately begun to become increasingly common among older adults. Her homocysteine level was dangerously elevated. Interestingly, her B12 levels were actually quite high, precisely because she had been diligently supplementing. But the combination of these two critical findings together told a compelling and alarming story of silent vascular damage that had been quietly accumulating for years, all while Dorothy believed she was meticulously doing everything right to maintain her health. Comment Dorothy below if any part of this story resonates with you or sounds familiar to someone you know. Now, let me explain in precise detail exactly what is happening inside the body and why the seemingly innocuous combination of B12 and these two specific medications creates a significant problem that standard routine checkups almost never manage to catch. The first medication we need to discuss is metformin. If you happen to have type 2 diabetes, there is a very high probability that you are currently taking it. It stands as one of the most widely prescribed medications across America for effectively controlling blood sugar levels, and it is genuinely effective at its job. However, metformin comes with a crucial side effect that most patients are unfortunately never clearly or thoroughly informed about. Over time, and particularly after years of continuous use, metformin actively interferes with a protein in your gut called intrinsic factor. Intrinsic factor is a vital protein that your stomach naturally produces, and it acts much like a specialized delivery vehicle for vitamin B12. You can think of it like a taxi service. B12 gets into this taxi, and the taxi then efficiently drives it to where it needs to go within your bloodstream to be properly absorbed and utilized. Metformin, through its long-term action, quietly damages this delicate taxi system. It makes it progressively less reliable, less consistent, and therefore less efficient. Consequently, when your doctor observes low B12 levels in your blood work, their natural and logical response is to say, you should take a B12 supplement. And so, you follow that advice. You go out and purchase a high-dose B12 tablet, often thinking that more must equate to better for your health. For a while, your measured blood levels of B12 do indeed go up, and your doctor, looking at the numbers, reassures you that everything appears to be fine. But here's what that blood level is critically not showing you. It's not revealing what is happening further downstream in your body's intricate systems. Because when B12 cannot be properly processed and transported efficiently due to the compromised intrinsic factor system, it begins to interact poorly with another naturally occurring molecule in your blood called homocysteine. And it is precisely with homocysteine where things genuinely start to become dangerous. Homocysteine is an amino acid that your body produces naturally as part of its metabolic processes. In small, controlled amounts, it is perfectly harmless, and your body has mechanisms to manage it. Your body skillfully uses other B vitamins, including B12, B6, and folate, to convert homocysteine into something useful and then clear it effectively from your bloodstream. However, when that crucial conversion process is disrupted, either because the B12 itself is not being properly absorbed or because it's not being processed effectively due to the intrinsic factor issue, homocysteine begins to accumulate in your system. Elevated levels of homocysteine in the blood do something very specific and incredibly damaging. It acts exactly like sandpaper, relentlessly abrading the delicate inside walls of your arteries. Please hit that like button if this detailed explanation is genuinely helping you to understand what is happening inside your body on a deeper level. A research team at Harvard Medical School described this phenomenon in a particularly vivid and precise manner. They explained that elevated homocysteine doesn't cause a sudden catastrophic blockage in the way that a blood clot typically does. Instead, it causes chronic abrasion. It systematically inflames the arterial wall, making it stiff and less pliable. This persistent inflammation and stiffness makes it much easier for harmful plaques to form and, critically, much harder for the blood vessel to expand and contract naturally, which is precisely how a healthy artery should function. Think of your arteries like a flexible rubber hose. When they are healthy, they are elastic, stretching, and rebounding smoothly with every single heartbeat. However, when homocysteine has been persistently scraping and damaging those internal walls for months or even years, the hose becomes progressively more like a rigid plastic pipe. And rigid pipes, unlike flexible hoses, are prone to cracking under pressure. They don't flex, they break. In the vital cardiovascular system, a break like that can have catastrophic consequences, leading to a stroke or a severe cardiac event. How many of you reading this have been on metformin for more than 3 years and are also taking B12 supplements? Please be honest with yourself right now, because this dangerous combination is occurring in people's bodies every single day, and alarmingly, almost nobody is connecting these critical dots. Now, the second medication I absolutely need to tell you about is one that even more people are taking, making its potential interaction with B12 incredibly widespread. Its interaction mechanism with B12 is distinct from metformin, but in some ways it can be even more unpredictable and thus more concerning. These medications are known as proton pump inhibitors, or PPIs, and they are commonly recognized by brand names such as omeprazole, Prilosec, and pantoprazole, Protonix. Their primary function is to significantly reduce stomach acid production. They are frequently prescribed for conditions like acid reflux, acid damage to the esophagus, and for the prevention or protection against ulcers. They are extraordinarily common among seniors because acid reflux tends to become more frequent and problematic after the age of 60, as the digestive system undergoes natural changes. However, PPIs do something else that most people never hear about at the pharmacy counter when they pick up their prescription. They drastically reduce the stomach acid that is absolutely necessary to release B12 from the food we eat in the first place. Your body specifically needs an acidic environment to effectively break down the protein bonds that hold B12 within various food sources. When you reduce that essential acid with a PPI over a period of months and years, your dietary B12 absorption significantly drops. A comprehensive study published in the Annals of Internal Medicine meticulously followed over 25,000 patients who were on long-term PPI therapy. It found that after just 2 years of continuous use, PPI patients consistently showed measurably lower serum B12 levels. After such a finding, what do most doctors typically recommend? They recommend a B12 supplement, which on the surface seems like a logical solution. The crucial problem, however, is that in certain individuals, particularly older adults with potentially reduced kidney function, the B12 supplement is not processed and cleared efficiently by the body. Instead, it accumulates in the blood in a form that interacts poorly with the crucial homocysteine cycle we just discussed, exacerbating the problem. But here's the part that is particularly concerning and unpredictable. Some patients on long-term PPI therapy can develop a condition known as rebound acid hypersecretion. This means that when they stop taking the medication, or even during the hours overnight when the medication is metabolized and its effect wanes, the stomach overproduces acid in a compensatory response. During this rebound window, the high-dose B12 supplement is being processed in an incredibly unpredictable environment. This leads to erratic absorption of the B12, and erratic absorption, in turn, translates directly to erratic homocysteine management. Some days, the system might effectively clear the homocysteine, while on other days, it simply doesn't. When was the last time your doctor specifically asked you whether you were on a PPI and also taking B12 supplements simultaneously? Type never in the comments right now if the answer is never. I genuinely want to see that number because I suspect it's going to be quite sobering and reveal a significant gap in patient care. Now here's where everything we've covered so far comes together to form a clear picture. The homocysteine connection is truly the heart of this entire complex issue. Homocysteine is one of those critical numbers that almost never shows up on a standard blood panel. Your doctor routinely checks your cholesterol, your blood sugar, your thyroid function, and perhaps even your B12 level itself. But homocysteine requires a separate specific test that has to be explicitly ordered. The Cleveland Clinic, a highly respected medical institution, has unequivocally called elevated homocysteine a significant and critically underrecognized risk factor for cardiovascular disease in adults over the age of 60. Yet, astonishingly, most seniors have never had their homocysteine levels tested in their entire lives. Here's precisely why that matters so profoundly. When your homocysteine levels remain elevated over periods of months and years, three distinct and damaging things begin to happen inside your cardiovascular system. First, the delicate inner lining of your arteries, known as the endothelium, becomes chronically inflamed and begins to lose its natural, smooth, and protective surface. Second, small, oxidized particles of LDL cholesterol, often referred to as bad cholesterol, find it much easier to embed themselves into these inflamed arterial walls, subsequently forming dangerous plaques. Third, and perhaps most critically, the plaques that form in such an inflamed, high homocysteine environment are significantly more likely to rupture unstably. This means they can break off from the arterial wall and travel freely in the bloodstream rather than remaining stably in place. That last point is the one that directly explains many strokes that occur in people who, upon imaging, show no major arterial blockages. The plaque was indeed there, but it was unstable and it suddenly broke loose. Researchers at the prestigious Mayo Clinic have found that elevated homocysteine is present in a disproportionate number of these so-called unexplained strokes. The cause, therefore, was not mysterious. It was simply that the right diagnostic test was never ordered. This information is absolutely not meant to frighten you without purpose or practical application. On the contrary, this is meant to empower you, to give you the essential knowledge that puts the power back into your hands regarding your health. And now that you possess a clearer understanding of what is happening inside the body, let me tell you exactly what tangible actions you can actually take about it. The answer is most definitely not to stop taking B12 entirely. Vitamin B12 is genuinely essential for your health, especially after the age of 60. A deficiency in B12 can cause nerve damage, profound fatigue, cognitive decline, and yes, it carries its own inherent cardiovascular risk. So, the goal is not to consume less B12. The goal is to be smarter about your B12 supplementation. First, if you are currently taking metformin for diabetes or a PPI like omeprazole for acid reflux, the single most important action you can take right now is to immediately ask your doctor to test your homocysteine level and your active B12 level. I emphasize active B12, not just the total B12 in your blood, but the specific form your body can actually use. Total B12 levels can often appear normal, while your active B12 is dangerously low. This critical distinction is often missed by many standard laboratory tests. Second, the form of B12 you take matters enormously. Most B12 supplements available on store shelves contain cyanocobalamin. This is the cheapest form to manufacture, but it requires your body to perform several complex conversion steps before it can actually be utilized. For older adults, especially those on metformin or PPIs, those crucial conversion steps are often compromised or inefficient. The form called methylcobalamin, however, bypasses most of those steps entirely. It is already in an active, usable state for your body. Research published in the European Journal of Clinical Nutrition found that methylcobalamin reliably raised functional B12 levels more effectively in older adults than cyanocobalamin at equivalent doses. Third, the dosage you take matters more than most people realize. High-dose B12 supplements, often ranging from 1,000 to 5,000 micrograms daily, are commonly sold and widely taken by individuals. However, the body can only absorb a very small fraction of that massive dose without adequate intrinsic factor. The rest floods the bloodstream in a form that may actually drive the homocysteine imbalance we've been discussing. A more targeted and appropriate dose, typically between 250 to 500 micrograms, in the methylcobalamin form, when taken in conjunction with a B6 and folate combination, provides the homocysteine cycle with everything it needs to function properly without overwhelming the system. Fourth, engage in a direct and thorough conversation with your doctor specifically about your entire medication list in relation to your supplements. Bring this up at your next appointment as a specific agenda item, not just as a passing question, but as the main topic of your discussion. Clearly state, I want to discuss my B12 supplementation in relation to the specific medications I am currently taking. That single conversation alone could profoundly change the trajectory of your cardiovascular health for the better. Allow me to tell you about Beverly, because her story is the one I truly want you to carry with you as a powerful example. Beverly was 74 years old and had been on a PPI for 14 long years. And for the last 5 of those years, she had also been supplementing with B12. Her daughter, after watching a video about homocysteine and its connection to heart health, insisted on bringing her mother in for a checkup armed with a printed article. Beverly was initially skeptical. She felt perfectly fine, her blood pressure was well managed, and she walked her dogs faithfully every single day. Yet, her homocysteine level came back at an alarming 31 micromoles per liter. To put this into perspective, the safe range is considered to be below 15. At 31, she had more than double the level associated with a significantly elevated stroke risk. And yet, she experienced no symptoms, no warning signs, no clue whatsoever, just a number on a page that precisely explained why her arteries were working far harder than they ever should have been. Following this discovery, her B12 supplement form was immediately changed to methylcobalamin. Additionally, a low-dose B6 and folate supplement was added to her routine to specifically support the critical homocysteine conversion pathway. The timing of her B12 dose was adjusted to be taken separately from her PPI dose in order to maximize its absorption efficiency. A follow-up homocysteine test was meticulously scheduled for 90 days later. When Beverly returned for her appointment 3 months later, her homocysteine had significantly dropped to 17. It wasn't perfect yet, but it was moving in exactly the right and healthy direction. She candidly told me that she hadn't even realized how truly tired she had felt until she started feeling less tired. If you have been doing this for years, please understand that it is absolutely not too late to make a change. The human body possesses a remarkable ability to recover and rebalance itself when you simply provide it with what it genuinely needs. The vascular inflammation that homocysteine causes is not permanent, especially when caught and addressed before a major cardiovascular event occurs. Beverly proved that remarkable capacity for recovery in just 90 days. Here is your clear, actionable plan to protect your heart health. First, meticulously check your medications. Are you currently on metformin for diabetes or a PPI, such as omeprazole for acid reflux? Second, carefully check your B12 supplement. What form is it? If the label says cyanocobalamin, you need to switch to methylcobalamin as soon as possible. Third, check your B12 dose. If you are taking more than 1,000 micrograms daily, you are very likely overdoing it and potentially creating problems. Fourth, schedule a homocysteine test. Call your doctor tomorrow and specifically request a homocysteine level test, along with an active B12 test. Fifth, incorporate B6 and folate support into your supplement regimen. These essential vitamins work synergistically with B12 to process homocysteine properly and keep your arteries healthy. What you have learned today is this: metformin and B12 can create a dangerous interaction through the intrinsic factor pathway, which over time leads to elevated homocysteine levels and significant arterial damage. Proton pump inhibitors reduce the crucial acidic environment needed for effective B12 absorption and can create an erratic processing environment that severely disrupts the homocysteine cycle. Homocysteine is almost never tested on a standard blood panel, and elevated levels in seniors are a significant yet critically underrecognized cause of stroke and other cardiovascular events. The effective fix is not to stop taking B12 altogether, but rather to switch to methylcobalamin at a smarter, more targeted dose, always with adequate B6 and folate support. Comment below and tell me if you are currently on metformin or a PPI, and also taking B12. I want to see how many of you this vital information applies to. And if this video has helped you understand a hidden danger you didn't even know existed, please do not hesitate to share it widely with anyone over the age of 60 who is taking these medications. Your simple act of sharing could literally save someone from experiencing a life-altering stroke. Don't forget to like this video and subscribe to my channel for more evidence-based health information that your doctor simply doesn't have the time to tell you during a typical 15-minute appointment. Please remember, this is not medical advice. Always consult directly with your healthcare provider before making any changes to your supplement routine or medication regimen, especially if you are currently on prescribed medications. Thank you for trusting me with your health education today. You now possess knowledge that most people have never been told, and that powerful knowledge belongs to the people you love too. Take excellent care of your heart, and I'll see you in the next video.